Hey everyone! Today we would like to present our concept analysis of the concept of advocacy. Our group includes Dylan Mollenauer, Emily Jackson, Courtney Arsenault, and Brittany Furrow. Hello, my name's Brittany. Our group decided to use advocacy as our concept for the concept analysis. Advocacy is a centralized concept to nursing because nursing is a client-centered profession. Nurses are the best people to be advocates for patients, to support their health decisions and helping to promote their well-being. Nurses are the people who are in and out of the patient's rooms every day, and they're the ones building that rapport and trust with the clients. Florence Nightingale said that nurses should be moral agents who should advocate for the care of others and follow an ethical practice. Also, the American Journal of Nursing states that advocacy extends beyond direct patient care and into policies, practices, and programs which should seek to restore health to the world. The meaning of advocacy is identified in many published nursing works. For example, the Online Journal of Issues in Nursing identifies advocacy as an integral aspect of nursing practice and a philosophical principle of the nursing profession, assuring rights and safety of patients. It's also highlighted in the Journal of Advanced Nursing as a mid-range theory as the safeguarding of patients' autonomy, acting on behalf of patients, and championing social justice in the provision of health care. And also, a major assumption of Nightingale's theory is that nursing is seen as being responsible for someone else's health. The general purpose of a concept analysis is to explore the structure of a concept by breaking it down into many different simpler terms in order to better understand the concept. It's kind of like the building blocks for nursing theories. It's also used to compare and contrast to other alike or different concepts. It also allows researchers to create hypotheses that reflect the relationship between the concepts. The purpose of the concept analysis for this concept of advocacy is to determine the role and importance of advocacy in the nursing profession related to patient safety and optimal health. Advocacy is defined as the act or process of supporting a cause or proposal. It can also be defined as partnering with the client to determine health needs and goals, educating and supporting the client in their decisions, pleading the cause for a client, as well as valuing, praising, and interceding on a client's behalf. Advocacy is also based on ethical conduct and professional responsibility. As described in Nursing Open, patient advocacy is focused on patient safety, including protecting patients, being a patient's voice, and educating patients. The defining attributes of advocacy include the valuing of a person or client, informing a patient or client, and interceding, such as a nurse intervening on a patient's behalf. The theoretical definition of advocacy is the act of valuing, informing, and interceding on behalf of someone else to promote safety and well-being.
A model case is one that exemplifies all of the defining attributes of a specified concept, and it can be described as, well, if this is an example of this concept, then nothing is. We will be discussing the concept of advocacy in nursing. There's a registered nurse who is assessing a 37-week pregnant outpatient for abdominal pain. She came in hurting 8 out of 10, saying her contractions are coming and going. She's placed on the fetal monitor, a sterile vaginal exam is performed. The RN notices that the baby's heart rate is minimal with no accelerations, and she's having irregular contractions on the monitor. The RN calls the doctor, informs the doctor of the patient's history, chief complaint, the irregular contractions, her pain, the strip that is not reactive, and the sterile vaginal exam. The doctor states that if the strip becomes reactive and if there is no cervical change in 1 hour, that the patient can be discharged home. So the RN returns to the room and reassesses the patient's cervix 1 hour after the initial exam. There is no cervical change. The strip is reactive, there are accelerations present, but there is still minimal variability. The patient is still complaining of 8 out of 10 abdominal pain, and the contractions are still quite spaced out on the monitor. So the RN recognizes the patient's pain, and she teaches her ways to help cope with this pain, different relaxation and breathing techniques, position changes, and how they can be helpful. She advocates for the patient in this way by recognizing her value and by understanding that she's in pain and that she needs to be assisted. So the RN once again calls the doctor and informs the doctor that there was no cervical change, but the patient is still having 8 out of 10 pain. The doctor states that the patient can be discharged home since the strip is reactive. The RN does not feel comfortable with this, so she intercedes and advocates on the patient's behalf, and she requests pain medication for the patient, and she requests that the patient remain on the monitor and not be discharged home at this time. The doctor agrees to this. The RN returns to the room and gives the pain medication to the patient. After giving that pain medication time to work, the RN returns to the room once again, and the patient states that the pain is better, but it is still a 7 out of 10. The RN also notices that the strip is once again not reactive with the minimal variability and no accelerations. So the RN decides to call the doctor again to give an update. After this update, the doctor does decide to order an ultrasound. Upon ultrasound results, there was a partial abruption noted, so the doctor does order a stat C-section. When the RN is in the room preparing the patient for the C-section, the patient states that she has many questions and that she would like some answers and she would like someone to talk to. The RN answers all the questions that she can, and she makes sure that informed consent is properly obtained for this patient. She once again advocates for that patient by making sure that the patient is properly informed before anything invasive is done on her behalf. The RN advocated through this patient throughout this whole scenario by focusing on patient safety. According to the text, there are two different types of borderline cases. The first borderline case we will discuss clarifies the defining attributes of the concept under analysis because it contains many of the same attributes. They are just characterized in different ways. A borderline case for advocacy would be the concept of support. We can use the same model case that we used for the 37-week pregnant outpatient to show this borderline case of support. So the same patient comes in with 8 out of 10 abdominal pain, just as the nurse advocated for the patient by recognizing her pain and treating it. In the model case, this RN supports the patient physically and mentally by educating her on various relaxation, distraction, and breathing techniques. When the RN calls the MD to inform of no cervical change, and the contractions remain irregular and accelerations are present with minimal variability, and the doctor gives discharge orders, the RN supports the patient's well-being by interceding on the patient's behalf. The RN also supports the patient's mentality by answering her questions and making sure that informed consent was obtained. This is the exact same scenario, and the RN acts in the same ways. It can just be defined as support rather than advocacy. The difference is that these could be defining attributes of support, but they do not have to be as they are for advocacy. Support is a much bigger term than advocacy. A different example of a borderline case is one that uses the same concept in a different context. An example of a borderline case of advocacy and nursing is an advocacy campaign. For example, a group of passionate citizens gathered together and created a plan to advocate for the oceans through the Save Our Seas campaign. These people have a goal of educating the population on numerous ways that their actions negatively affect the oceans and the creatures that live in it. Just as advocating for a patient, you inform them and make sure they are educated. They recognize the importance of not only the creatures, but also the oceans themselves. Once again, just like advocation, they are valuing the patient. In a way, these advocators are interceding on behalf of the ocean and its inhabitants by making a case for them since they cannot make a case for themselves. Once again, similar to advocacy and nursing. One main difference between the two is that the actions of the people advocating are towards other people instead of the actual patient, which would be the oceans and the inhabitants of the oceans. These two different concepts share many of the same foundational meanings and even defining attributes. They are just applied in different scenarios.
For the related case for our concept, we chose beneficence. A related case recognizes a concept that is similar to the concept being analyzed, but it does not exemplify all the defining attributes of the concept being studied. Similar to the defining attributes of advocacy, beneficence recognizes the patient's value and well-being, and it recognizes the importance of patient safety. The lacking defining attributes include informing and interceding. An example of this case, we're using the subject of a laboring mother with a spinal epidural. In act of beneficence, the registered nurse places the call bell within reach, raises the side rails to prevent falls, and provides assistance with frequent position changes to aid in the process of labor and prevent skin breakdown. For the contrary case for this concept, we chose indifference. A contrary case is the opposite of a model case and are examples that are obviously not the concept under analysis. For the example of this case, the registered nurse is displaying the concept of indifference. A patient was admitted experiencing fetal demise. The registered nurse does not see the importance of educating the mother in grief, loss, and availability of support groups. The registered nurse fails to provide pain medication in a timely manner. There is no attempt to console the crying mother, and the fetal footprints are obtained in a hurried and unthoughtful way. And the memory box was not individualized for the patient, and the registered nurse places it in the room without educating the patient on the contents. For the invented case, we're looking at advocacy in a different way. Invented cases are cases that occur when concepts are taken out of their original context and are placed in a scenario that have not and probably could not actually happen. For the example of this case, we're utilizing the Save Our Seas campaign. In this context, the oceans and the creatures of the ocean can speak for themselves. The oceans in aquatic life state that they are in pain and have physical and mental trauma. The aquatic caregiver advocates for them by recognizing their value and importance and by listening to their concerns. The caregiver offers pain medication and removes the toxic pollution within. The caregiver educates citizens on the negative effects of pollution on the ocean and aquatic life. The aquatic caregiver also educates and informs the oceans about the trial medications that they are receiving.
Antecedents are those events or incidents that must occur or be in place prior to the occurrence of the concept. So, an antecedent cannot also be a defining attribute for the same concept. Antecedents to advocacy can include a vulnerable or marginalized population and a nurse who is willing to help. For example, vulnerable populations can include mentally disabled patients or patients who are sedated without family present at the bedside. The nurse in this case would be advocating for a new medication, alteration of current care, and care upon discharge. The nurse typically must be brave and step outside of his or her comfort zone to do this. Consequences are those incidents or events that occur as a result of the occurrence of the concept, also known as the outcomes of the concept. The consequences of patient advocacy could be good or bad. Positive patient advocacy can bring to fruition better care for the patient, better quality of life for the patient, and protection of the patient's rights and wishes. Negative outcomes can occur when the nurse, who is the patient advocate, is penalized for bringing to light poor patient care or need for improvement. The nurse can be criticized by management, physicians, and coworkers. This can have a negative impact on patient advocates because it can cause lower self-esteem, poor reputation, and decreased advocacy of this nurse in the future. Empirical indicators are classes or categories of actional phenomena that by their existence demonstrate the occurrence of the concept itself. The defining attributes and the empirical indicators are oftentimes identical. Empirical indicators are the means by which you can measure the defining attributes, and they relate directly to the defining attributes, but not the entire concept. Clinicians can evaluate advocacy quantitatively with patient satisfaction surveys. These patient satisfaction surveys are the most common assessment tool. These tools include privacy and vendor surveys, but their reliability is unclear because the results are usually not published. Public and standardized tools include patient satisfaction questionnaires. Examples of these are the PSQ-18 and Consumer Assistant Health Plans, also known as CAPS. These have good reliability and validity, but they offer a limited amount of survey questions. Qualitative tools include patient interviews with detailed discussions and online forums. Empirical indicators for advocacy can include patient status, patient safety, and patient satisfaction. A nurse who is a patient's advocate ensures that the patient improves or maintains their functional status, keeps the patient safe, and keeps the patient satisfied. Functional status can include items such as toileting, activities of daily living, walking, dressing, and bathing. Nurses can advocate on a patient's behalf for physical therapy or occupational therapy to improve or maintain this functional status. Patient safety includes prevention of medical errors, hospital-acquired infections, and decubitus ulcers. Patient satisfaction can be measured with a quantitative patient survey or a qualitative survey with an interview. Advocacy in nursing is important because nursing is a client-centered profession, and sometimes nurses are the only patient's voice. Advocacy involves supporting patients to make their own health decisions and promote their own well-being. The purpose of creating a concept analysis about advocacy is that we are deeply able to explore and understand this concept. This is vital because concepts are the building blocks of nursing theories. Defining attributes of advocacy include value of the person, informed consent, and interceding on the patient's behalf. Advocacy on behalf of the patient helps to maintain their safety, promote healing, and help to improve patient satisfaction scores.